Looks like everyone's favorite unrighteous dude, Prime Minister Justin Trudeau, is saying it was a misunderstanding that caused a BC-based company to say Health Canada granted it permission to produce, sell, and distribute cocaine. Trudeau told reporters in Winnipeg on March 3rd that he was as surprised as BC's Premier David Eby when he heard that the company, Adastra Holdings Limited, which produces marijuana for adult use and medical sales out of its headquarters in Langley, BC, announced on February 22nd that it was permitted by Health Canada to legally possess, produce, sell, and distribute cocaine, especially since, to the best of his knowledge, no Liberal insiders had ownership of Adastra. The company said in a news release that it had been granted a Health Canada amendment to its controlled substance dealer's license on February 17th. Maybe they shouldn't have mentioned the misunderstanding publicly, kept it on the down low, the QT. Eby first responded to the company's statement on March 2nd, saying that he was astonished that Health Canada would grant the amendment and that his government would be contacting Health Canada for answers. I was as surprised as the Premier of British Columbia was to see that the company was talking about selling cocaine on the open market or commercializing it, Trudeau said on March 3rd. There are limited and very restricted permissions for certain pharmaceutical companies to use that substance for research purposes and for very specific, narrowly prescribed medical purposes. But it is not a permission to sell it commercially or provide it in an open market. Well, not at least until we can cut Big Pharma in on the action. All right, Justin didn't say that part, but come on, we all know he was thinking it. The Prime Minister said his government is actively addressing the issue. Well, that makes at least one issue he's actively addressing. That's a plus. We are working very quickly with this company to correct their misunderstanding that their press release has caused, he said, adding that decriminalizing the commercial sale of cocaine is not something that this government is looking at furthering. Furthering? Of course not. I mean, why would they want to do such a thing? This would only lead to more addiction and dependence, further harming existing addicts and creating a myriad of new ones, all of whom would ultimately become dependent on big government for their survival, effectively making them wards of the state without any voice. Yeah, absolutely. Furthering? Hell no. In case you didn't know it, BC, which also stands for Best Cannabis, Best Crack, Best Cocaine, decriminalizing possession up to 2.5 grams of certain hard drugs, including cocaine, began on January 31st, following Health Canada's approval of a 3-year experimental decriminalization exemption program going back to May of 2022. So, what was the logic behind this decriminalization? Well, according to federal mental health and addictions minister, Carolyn Bennett, she touted that BC's decriminalization plan will reduce, ready? The stigma, the fear, and shame that keeps people who use drugs silent about their use or using alone. Makes sense. They should be able to shout out about their drug use, just like abortions. I mean, after all, what's pride for if we can't shout proudly about our drug use and ending using alone? And as far as using alone, makes sense to me. I mean, when you overdose, someone's got to call 911. In 2022, BC had an average of over 6 people dying from drug overdoses every day. And 11,000 people in the province have died from illicit drug overdoses since the provincial government declared a public health emergency in 2016, according to the government. So, granted my math may be a bit off here, but given it's now 2023, and the public health emergency was declared in 2016, even longer than COVID, that's 7 years according to white imperialist math. 11,000 deaths have happened during this time due to drug overdoses. That's 1,571 deaths per year on average. but recent numbers are over 6 deaths per day. Not sure why they can't tell us the exact amount, but for now, let's go with 6 deaths per day. Using that and multiplying it by 365 days in a year, that's 2,190 overdose deaths per year. 2,190 seems to be higher than what we've been averaging thus far at 1,571 deaths per year. Yep, seems like another stellar example of government policies working so well. Federal Conservative Party leader Pierre Poilievre has criticized the decriminalization policy, saying the solution to the issue of addiction is more treatment and recovery rather than more poison. Science denier. Come on, Pierre. Doubling down on stupid policies worked so well when it came to COVID. Really, didn't it? Both Trudeau and Justice Minister David Lametti have said Ottawa has no plans for a national drug decriminalization policy. I mean, how could they? Given they're still waiting for input from all the stakeholders, like Big Pharma and the drug cartels. Anyway, thanks for watching. I do appreciate it. Please post any comments you have in the comment section. You can also follow me on my Rumble and my Locals account. If you haven't yet subscribed to my channel, what are you waiting for? Do so. And check out some of my past videos, and I'll see you later, dude.